Yes, thank you. Welcome back. I was telling you how important preconception counseling is, and the other things that we normally do during this preconception counseling. We normally screen for some of these genetic diseases like sickle cell disease and even cystic fibrosis. And when these are screened, it will help us in the prevention of complications that may occur, because it may affect outcome of our among these pregnant women. So we normally want to screen. And I know very many in the community there, they don't go for this preconception screening for these genetic diseases. I must tell you, very key, come to the facility, know your status very well, and we will know how to help you. We also help in doing some other prenatal diagnosis for chromosomal or genetic diseases that are normally going to be discussed in case there are any that we presume people who have risk factors. Normally we discuss with these pregnant women. And so we normally do this during preconception counseling. It is done during preconception counseling so that we prevent poor outcome. Some of the things that are important that I want the stakeholders to know is the danger signs or symptoms that appear when women are pregnant. All these danger signs are reflected in our revised World Health Organization maternal and newborn or prenatal care guidelines. One of them is extreme swelling of hands, feet, and wrists. If you see this, you must come to the facility so that we can screen you and see what could be causing the problem. Headaches and prolonged vomiting, or severe or actually repeated vomiting, it is important to come to the facility so that we can screen. Pain in the abdomen or chest, it's important to see the doctor. Bleeding, spotting, or draining of water, what you call water from the vagina. But of course, this could be a live one that is draining through the vagina. So it is important to come to the facility. When you have eye problems such as blurring of vision or any disturbances, photophobia, swelling of eyelids, they are important so that you can come and assess some of these conditions may be associated with high blood pressure, what we normally call severe or preeclampsia with severe features. Bladder troubles, especially when you have painful urination and blood-stained urine. Sometimes you may have chills, fever, and some fatigue that are really not weird fatigue. You should come to the facility and we assess you. When you have had high blood pressure before, or even presence of varicose veins, it's important to come to the facility for the assessment. Some of these things are not only done during antenatal, but once we detect it, it will be normally wants to manage. But if these signs, the danger signs and symptoms appear, please come to the facility irrespective of the antenatal care visits that we may have. This, because of time, I would like to request us to end here. I want to thank all the members who are there listening to us. I would like to welcome questions from anybody. Thank you very much. Yes. Any question? You can unmute and ask. Is that Mokasa? Yes. Jackie, you want to comment? Jackie Oloya, we are happy to have Jackie as us. She is attending from Germany, and I think it is important to have her make a comment.
Well, thank you very much for your presentation. It's been very good. I must say, I only went through the antenatal during my training, and I haven't worked there, but I've really appreciated this from your presentation. And what I would like to say is that I think anything that we bring to our sub-region in terms of medical. Can you hear me?
Yes, please. Loud and clear. Go ahead.
Oh, okay, because I thought maybe I should remove the earphones. Yeah, so what I was saying is that I would like to applaud you for bringing this service nearer to the people, and as well as taking the time to educate whatever you call the antenatal literacy among the people. I think this is a very big step into ensuring safe delivery, pregnancy care, and post delivery care, which is always very crucial because, like, you always find you hear a baby has been born, and then after some time they've gone back to their homes or villages, and maybe things don't work out the way because of post antenatal care, and sometimes also the lack of the facilities, that they are so few, and then maybe it is not, the people cannot afford the costs involved. But when we have these services come to our areas, it means the costs will also with time go down, and the services will reach a bigger number of people. So I would really like to encourage you and applaud you for doing this, starting the Jowa and all the services that we are delivering to people. Thank you very much. Maybe at a later stage, I can say something again if it comes across my mind. But I would like to say thank you very, very much.
Thank you.
And maybe before I go is before I leave the microphone is that I think also coming out to speak to the people will actually improve the services that you give, because whatever happens within your center will directly reflect on the center and also on the people who come for your services. And I think it is really good to be bold the way you are and to come and educate us on this. Thank you. Thanks a lot.
Thank you. Thank you. I'm Hapo. Jackie Oloya from Germany. She's one of the tutor at the university in Germany there. The German names are very difficult, so it's difficult to pronounce that German university in their local language. But thank you for
sorry, Dr. Jim, I work for Munich University Hospital. I am an ICU nurse, and I'm also a practical trainer of nurses. And for me, service delivery and how we, the nurses, deliver our services is key in any hospital. It doesn't matter what we have, but it is how we present ourselves. The nursing etiquette is what opens the way how we can also help our patients, because life comes first. My students, I always tell them that once you're in hospital, you should know you're not in McDonald's or you're in Burger King where you're dealing with plates. We deal with life, and we are always happy when we save a life every day.
Yes.
So it is our nursing etiquette. Thank you very much.
Thank you, Jackie Oloya. I think she has made it clear. And she works for Munich General Hospital in Germany. Thank you for being with us and continue being with us, continue encouraging us. It is good to see our very own practicing abroad and yet still have the feeling for helping people at home by this kind of ideas, encouraging us to move forward. Thank you very much for being with us. I think I would welcome any other comments. I can still see, yes, Kilama David, your own. Please, may you admit and give your comments. Kilama is one of the active member in Bade district, and he is a prominent member there. He has been doing a lot in Bade district.
Yes, doctor. Yes, doctor.
Yes, yes.
Are you getting me? Yes.
Go ahead, go ahead.
Thank you. Thank you very much for wonderful presentation. We are so grateful. But the people out here, they are requesting if the program can also be put in the local language that everyone can understand, because it's too beneficial for the people.
Right. Thank you very much.
Yes.
Thank you very much, Kilama. I think
Yeah.
I think the administration of the facility has taken note. However, today this is our first presentation. As a facility, we started making this come into light because we realized that if we do this for our community, this is a way of giving back. This is for free. You get the information for free and use it for free. So we think that if the facility still has more docket of sponsoring this kind of presentation, yes, we will be talking about these things in local language. But for today, we think that there were so many people who joined in and they were not from our region and they don't understand the language. So we realized that, yeah, maybe for mutual benefit, let's first have today most of the session being spoken in English. But I take that seriously. Mr. Kilama David, thank you.
Welcome.
Yes, Otim Paul, you have any comment before we close? Well, I think, thank you everybody who managed to attend. We managed to have a maximum number of about 22 people at the beginning of the session. Of course, we had some technical issues to do with internet. I think we went off abruptly, but yes, we are here. And we think that by your encouragement, by what you have said, the management have taken note and they will actually make sure that such kind of empowering our people. We call it the Health Awareness Program at Jowa Medical Center. So we want to empower people, stakeholders, to actually participate in improving their health. We think that once your health is fine, you have good health, you are going to be a happy person, irrespective of your financial status, irrespective of your religious affiliation, irrespective of who you are, where you come from. So this is why we initiated this program. Thank you. I think Oloya, I think you want to make final comments, and then finally you can help us close the program.
I would like to ask you the capacity of the center. What is your minimum in a month? How many patients do you handle? And the severity of the complications that you have so far had, and how long you've been in existence. Thank you.
Yes, thank you, Jackie. I think I will need to send you some of the documents that we have, just give you a better idea. But this facility previously was in Pate district. So the facility was also, the name still remained the same, Jowa Medical Center and Maternity Home. It was previously located in Pate district in the town council of Bajule, where I happened to have worked there for some years. So we started the facility in 2017, in 2015 in Bajule, and so it's been there for quite a long time. Recently, we realized that the facility managed to send one of the medical officers back to specialize. And therefore, after I specialized, we realized that we need to provide specialist services to the people, and it is better provided in the city, where of course the population are many, where we are going to maintain the facility and where we are going to maintain the specialists. So I happen also to be working at Gulu University at the Department of Reproductive Health. Faculty of Medicine, so it is easily accessible by me, who is a specialist at the facility. I am an obstetrician and gynecologist, as I said before. So we are offering wide services. So recently we have transferred here in the city. We have a big space. However, the patient flow is still few, but we hope that they come. Our services are not expensive though, but they are of high quality. In the last 2 weeks that we have been able to open, we have been able to conduct about 4 operations, including 1 or 2 major operations. And then we have had some deliveries at the facility here. So we want more patients to come in and we help them. I think briefly that's what I can say, Jackie. We expect more patients to come in, and so we can help them.
Thank you very much.
Yes, yes. Thank you, Jackie. You can give your word of thanks and we close this meeting.
Okay, thank you very much, Dr. P. Again, sorry, I was German. Thanks a lot. And I would like to make one appeal to all of us who have been able to attend this session today. I assume that most of you are medical workers in different capacities. So my appeal is that let us support one another. Let us try to give the best that we can give. I know that the circumstances and conditions of work in Uganda is very different from maybe here where I am. But I think if we all give the little we can, like Dr. Ope is also trying, I think we shall have a healthier community and also make the livelihood in our society much better. I would like to say once again, thank you so much, Dr. Ope, for this session. It has been very good, I must say. Well, the presentation was well conducted research, and it gave the details that even if someone did not have any knowledge in antenatal, then they would get out of here with so much knowledge and appreciation. Would like to thank you for this, and I would like to thank each and everyone who is still here, and even those who did not manage to come back. Maybe you will convey that on the forum, but it's been good. Thanks a lot, and let us keep this up and make our communities, our society, better places to live in. Thanks a lot.
Thank you everybody. I wish you a very lovely weekend. Bye-bye.
Thank you.